10 warning signs of testicular cancer. You should not ignore. Did you know that testicular cancer is one of the most common cancers among young men aged 15 to 35? It's often overlooked and misunderstood, yet it's important to know its warning signs. With over 9,000 new cases expected in the US in 2025 alone, testicular cancer is a major health concern that demands our attention. What's even more alarming is that testicular cancer can develop rapidly and may not cause noticeable symptoms in the early stages. This makes early detection super important. When caught early, the 5-year survival rate for testicular cancer is over 90%. However, recognizing the warning signs and taking prompt action is key to achieving this high survival rate. In this video, we'll uncover the 10 warning signs of testicular cancer you should never ignore and break down the critical symptoms to watch for. But before we get started, let's first define testicular cancer and understand how it begins. Testicular cancer begins in the testicles or testes, which are the male reproductive organs responsible for producing sperm and hormones. It is often linked to genetic mutations and developmental abnormalities. Normally, during pregnancy, the testicles of a male child form in the abdomen and later descend into the scrotum. However, if this process is disrupted, it can lead to irregularities that may increase the risk of cancer. One of the biggest risk factors for testicular cancer is cryptorchidism or undescended testes. This occurs when one or both testicles fail to move into the scrotum during fetal development. Males with a history of cryptorchidism have a higher risk of developing testicular cancer later in life. Another major risk factor is a family history of the disease. If a close relative has had testicular cancer, the chances of developing it may be higher. Similarly, men with a first-degree relative, such as a father or brother, who has had testicular cancer are at a higher risk of developing the disease. Genetic mutations can also play a role, particularly mutations in the KIT gene, which is essential for cell growth and development. When this gene mutates, it can trigger the uncontrolled growth of cancer cells. Now let's explore the top 10 warning signs of testicular cancer you should never ignore. Number 10, a lump or swelling in your testicle. Imagine going about your day when you suddenly notice a lump or swelling in your testicle. This could be one of the first warning signs of testicular cancer, and it's important not to ignore it. A lump or swelling in the testicle is caused by abnormal cell growth, forming a tumor. Tumors can be benign, meaning non-cancerous, or malignant, meaning cancerous. In testicular cancer, the lump is usually malignant and needs prompt attention to prevent spreading. So how can you check for a lump or swelling? The best method is a self-examination. This can be done during or after a warm bath or shower when the scrotum is relaxed. Gently roll each testicle between your thumb and fingers, feeling for any lumps, changes in size, or irregularities. It's normal for one testicle to be slightly larger than the other, but any major changes should be evaluated by a doctor. Number 9, ache or pain in your testicle or scrotum. Have you ever felt pain in your testicle or scrotum? Whether it's a dull ache or a sharp sting, it could be an early warning sign of testicular cancer. The pain may come and go or remain constant, often accompanied by a feeling of heaviness in the scrotum. But what causes this pain? As testicular cancer progresses, the tumor grows larger, putting pressure on nearby structures and nerves and leading to discomfort. In addition, inflammation from the cancerous growth can further contribute to pain in the testicle or scrotum. However, not all testicular cancers cause pain, but when they do, it may be due to fluid buildup around the testicle, a condition called hydrocele, which can sometimes be linked to testicular cancer. But you don't have to wait for a doctor to catch these signs early. Regular self-examinations can help detect any changes. Gently feel each testicle and the surrounding area for lumps, swelling, or changes in texture. If you notice anything unusual or experience persistent pain, see a doctor as soon as possible. Number 8, pain radiating from the back or lower tummy. Imagine going about your day when a sudden, persistent pain strikes your lower back or abdomen. It's not the kind of pain you can simply ignore because it could be an important warning sign that testicular cancer has spread beyond the testicles. Here's how it starts. When testicular cancer spreads or metastasizes, it often spreads to nearby lymph nodes and other organs. As the cancerous cells grow, they put pressure on surrounding tissues and nerves, leading to pain in the lower back or abdomen. This discomfort can range from a dull, constant ache to sharp, intense pain that worsens over time. If testicular cancer spreads to internal organs like the kidneys, it can create additional pressure, leading to even more discomfort. To catch this symptom early, pay close attention to any persistent or unusual pain in your lower back or abdomen. Take note of when the pain occurs, how intense it is, and whether it spreads to other areas. If the pain persists or worsens over time, it's a clear sign to seek medical attention immediately. Number 7, heavy or hard scrotum. This symptom might seem like a minor change, but if it comes with swelling or pain in the testicles, it could be a sign of testicular cancer. A heavy or hard scrotum can result from several factors, including fluid buildup or vein enlargement. One common cause is hydrocele, where excess fluid accumulates around the testicle, leading to a sensation of heaviness and an increase in size. While hydroceles are usually painless, the added weight can cause discomfort. Another possible cause is varicocele, which is a condition where the veins inside the scrotum become enlarged. Varicoceles are similar to varicose veins that form in the legs, and they can cause a feeling of heaviness or aching in the scrotum. They're typically more noticeable when standing or being active, and less so when lying down. Regular self-examinations are essential for early detection. Set aside a few minutes each month to become familiar with the usual feel and appearance of your testicles. This way, you can spot any changes or abnormalities early. Number 6, shrinking testicle. Have you ever woken up to notice that one of your testicles has reduced in size? This can be a leading symptom of testicular cancer. Cancerous cells may disrupt the normal function of the testicles, causing them to shrink. As the tumor grows, it can damage healthy tissue, interfering with the testicle's ability to produce sperm and hormones, leading to a reduction in size. Hormonal imbalances can also contribute to testicular shrinkage, a condition known as testicular atrophy. Conditions like hypogonadism, which results in reduced hormone production, can play a significant role. Additionally, certain hormonal treatments for other medical issues can lead to testicle shrinkage. To spot any changes, it's important to regularly examine your testicles and be aware of any differences in size. If you're finding this video helpful, make sure to hit the like button and subscribe to our channel. And don't forget to click the notification bell so you never miss an update. Your support helps us bring more valuable content to you. Now let's continue. Number 5, breast tenderness or growth. While it's rare for men to develop breast tissue, when it happens, it could signal an underlying health issue, such as testicular cancer. This unusual symptom shouldn't be ignored, as it might point to a serious condition that requires medical attention. The connection between breast growth in men and testicular cancer often lies in the production of a hormone called human chorionic gonadotropin, or HCG. Certain types of testicular tumors, like choriocarcinoma, can produce excessive amounts of HCG, which stimulates breast tissue growth and may cause tenderness or swelling. This hormonal imbalance disrupts the body's normal functions, leading to these noticeable changes. Similarly, estrogen, a hormone usually linked to female characteristics, can also be produced by certain testicular tumors, causing changes in breast tissue in men. Number 4, sudden buildup of fluid in the scrotum. Normally, there's a small amount of fluid in your scrotum, but if this amount suddenly doubles, it could indicate a problem. This condition, known as hydrocele, can occur when cancer cells accumulate in the testicle, causing inflammation and irritation that leads to fluid buildup in the scrotum. This can result in a swollen, painful, or tender scrotum. Men who notice a sudden fluid buildup in the scrotum should seek medical attention, especially if they experience any of the following: a swollen or enlarged scrotum, pain or tenderness, or a feeling of heaviness or discomfort. Number 3, pain in the groin. Do you feel a sharp, stabbing, or dull ache in your groin that makes even simple tasks like walking or sitting painful? The groin area, which includes muscles, tendons, and ligaments around the pubic bone, is complex and can be prone to various types of pain. When it comes to testicular cancer, the pain is usually caused by a tumor in the testicle that presses on surrounding tissues and nerves. This pressure can lead to discomfort. Additionally, cancer growth can cause inflammation and swelling, worsening the pain. In some cases, the pain may result from cancer spreading to nearby lymph nodes or other areas, making the symptoms more complex. So how can you tell the difference between harmless muscle pain and something more serious? Pay attention to any persistent or worsening groin pain that doesn't improve with rest, time, or over-the-counter pain relievers. Pain linked to testicular cancer may also come with a feeling of heaviness or tenderness in the testicle or scrotum, offering more clues to the underlying cause. Number 2. Swelling of one or both legs. If you wake up one morning and notice swelling in one or both of your legs, it could be a sign of testicular cancer. This condition, known as lymphedema, can occur when testicular cancer spreads to the lymph nodes. Lymph nodes are small, bean-shaped structures that are part of the lymphatic system, which helps fight infections and remove harmful substances from the body. When cancer cells spread to the lymph nodes, they can block proper lymphatic fluid drainage, leading to swelling. This blockage causes fluid to build up in the tissues, leading to swelling in the affected area. The swelling is often more noticeable in the lower leg and may sometimes spread to the scrotum or lower abdomen. To determine if the swelling is related to testicular cancer, look for other symptoms like pain, redness, or warmth in the scrotum, which could signal a more serious issue. Number 1. Shortness of breath. If you've ever experienced shortness of breath, you know it feels like you're struggling to catch your breath, as if you're gasping for air. Shortness of breath can be a subtle yet important symptom of testicular cancer, especially in its later stages. This symptom can often be overlooked or mistaken for other conditions like asthma or chronic obstructive pulmonary disease, COPD. However, if it's accompanied by other signs, such as chest pain, lower back pain, or swelling in the legs, it could be an indication of testicular cancer. With that being said, if you experience any of the 10 symptoms mentioned in this video, it's super important to see a doctor. A healthcare provider can conduct a thorough examination to determine the cause and recommend the appropriate treatment. We hope you found this information valuable and insightful. If you did, please don't forget to give this video a thumbs up, share it with others, and subscribe to our channel. Kindly hit the notification bell so you never miss an update on important health topics. Remember, the information provided in this video is for educational and informational purposes only. It is not intended to replace professional medical advice. Always consult with your physician or a qualified healthcare provider before making any significant changes to your diet, exercise routine, or healthcare plan. Your health is important, and having professional guidance can make all the difference in ensuring the best outcomes. Before you go, don't miss our must-watch video that uncovers the shocking truth about PFAS and their connection to cancer. Discover how 3M's toxic legacy has triggered an ongoing legal battle and what it means for the victims. Click the link in the description box below to watch it now.